endless and wearisome land. Now I've got a home with that yonder city, the good Lord, a home that was not made by me. I got a mother, a sister and a brother who have all passed on before. Now I'm determined to go and meet them, good Lord, over on that other shore. Just to cleanse this weary soul. If I could touch but the hem of his garment, good Lord, I do believe I would be made whole. Just to cleanse this weary soul. If I could touch but the hem of his garment, good Lord, I do believe that I would be made whole.
Yeah. Russians. Yeah. Sure of it.
Flooded, and he just opened the doors and the water was flooding through. Well, it got so much silt in the. What are you
A lot of hits, you know, I didn't hear any kind of regular game.
sacred things.
Just another guy on the watchtower. Just an echo that lost.
What was going on there?
Well, my thoughts wander back to that rim shop. Well, I wonder when I was there. When my mama and dad.
As the fourth generation Dr. Penner here in Peak, I would like to welcome everybody to the centennial celebration of the Penner Clinic. It's hard to fathom that 100 years ago a medical practice was established on these grounds by my great-grandfather that is still in existence today and served by the same family. So much has changed in medicine and healthcare since that time. To put things in perspective, I reviewed several articles that were published by the Centers for Disease Control that discuss some achievements in public health over the 20th century. I'll start with the public health system. In the early 1900s in the United States, many major health threats were infectious diseases associated with poor hygiene and poor sanitation, diseases associated with poor nutrition, poor maternal and infant health, and diseases or injuries associated with unsafe workplaces or hazardous occupations. The success of the early public health system to incorporate biomedical advances such as antibiotics and vaccines and to develop interventions such as health education programs resulted in decreases in the impact of these diseases over the 20th century. In the last half of the century, public health identified risk factors for many chronic diseases and intervened to reduce mortality. At the beginning of the century, many public health initiatives were started and supported by non-governmental organizations. However, as federal, state, and local public health infrastructure expanded, government's role increased and assumed more responsibility for public health research programs. Today, public health represents the work of both government and non-government organizations. As a timeline, in 1930, Congress established the National Institutes of Health and the Food and Drug Administration. The Centers for Disease Control was established in 1946. Legislation to form Medicare and Medicaid was enacted in 1965, and the Occupational Safety and Health Administration and the Environmental Protection Agency were organized in 1970. Most recently, the Affordable Care Act was signed into law in 2010, and health insurance exchanges and health care reforms were enacted in January of 2014. Family planning. During the 20th century, the hallmark of family planning in the United States was the ability to achieve desired birth spacing and family size. Fertility decreased as couples chose to have fewer children. Concurrently, child mortality declined. People moved from farms to cities, and the age of marriage increased. Smaller families and longer birth intervals have contributed to better health of infants, children, and women, have improved the social and economic role of women. In 1912, the modern birth control movement began. The first family planning clinic opened in 1916 in New York. By the 1930s, a few state health departments and public hospitals had begun to provide planning services. In 1960, the era of modern contraception began when both the birth control pill and intrauterine device became available. Since 1972, the average family size has leveled off at approximately 2 children, and the safety, efficacy, diversity, accessibility, and use of contraceptive methods has increased. Control of infectious diseases. Deaths from infectious diseases declined markedly in the U.S. during the 20th century. The decline contributed to a sharp drop in infant and child mortality and to the 29-year increase in life expectancy. Disease control resulted from improvements in sanitation and hygiene, the discovery of antibiotics, and the implementation of universal childhood vaccination programs. Penicillin was developed for medical use in the 1940s, and since that time, antibiotics have saved the lives of persons with numerous types of bacterial infections. Medications have also been developed to treat viral, fungal, and parasitic diseases. Safer and healthier foods. In the early 20th century, contaminated food, milk, and water caused many foodborne infections. Once the sources and characteristics of foodborne diseases were identified, long before vaccines or antibiotics, they could be controlled by hand washing, sanitation, refrigeration, pasteurization, and pesticide application. Healthier animal care, feeding, and processing also improved food supply and safety. In the early 1900s, it was unknown that minerals and vitamins were necessary to prevent diseases caused by dietary deficiencies. Recurring nutritional deficiency diseases such as rickets and scurvy were thought to be infectious diseases. By 1916, new data led to the discovery that food contained vitamins and that a lack of these could cause disease. This resulted in public health policies such as food fortification programs that led to substantial reductions in nutritional deficiency diseases during the first half of the century. During the 1920s, refrigerators with freezer compartments became available for household use. During the 1950s and 60s, pesticide regulation evolved to require maximum allowable residue of pesticides on foods and to deny registrations for unsafe or ineffective products. In 1941, President Franklin D. Roosevelt initiated a program to enrich wheat flour with vitamins and iron. In the 1940s, fortification of milk with vitamin D was a critical step in controlling rickets. The focus then shifted in the second half of the century from disease prevention to control of chronic conditions such as cardiovascular disease, diabetes, and obesity. The Framingham Heart Study was initiated in 1949, which identified the contribution of diet and sedentary lifestyles to the development of cardiovascular disease and the effect of serum cholesterol on the risk for coronary artery disease. By the 1970s, food and nutrition labeling and other consumer information programs stimulated the development of products low in fat, saturated fat, and cholesterol. Healthier mothers and babies. From 1915 to 1997, the infant mortality rate declined nearly 90%, and the maternal mortality rate declined almost 99%. The discovery and widespread use of antimicrobial agents and the development of fluid and electrolyte replacement therapy and safe blood transfusions accelerated the declines in infant mortality. During the late 1960s, after Medicaid and other federally funded programs were implemented, infant mortality declined substantially. Public health actions also played a role during the second half of the century. For example, a greater than 50% decline in SIDS rates has helped to reduce the overall infant mortality rate. As for maternity care, in the early part of the century, obstetrical care was provided by poorly trained or untrained medical practitioners. Most births occurred at home with the assistance of midwives or general practitioners. During the 1940s, the proportion of infants born in hospitals increased from 55 to 90%. This shift, though, was slow in rural areas in southern states, such as in Peak. Vaccines. At the beginning of the 20th century, infectious diseases were widely prevalent in the U.S. and exacted an enormous toll on the population. In 1920, nearly 470,000 measles cases were reported, and over 7,500 patients died. Nearly 148,000 diphtheria cases were reported, and over 13,000 patients died. Since 1900, vaccines have been developed or licensed against 21 different diseases. This created a dramatic decline in vaccine-preventable diseases. Morbidity associated with smallpox and polio caused by wild-type viruses has declined 100% and nearly 100% for 7 other viruses. By 1977, the eradication of smallpox enabled the discontinuation of prevention and treatment efforts. The last documented indigenous transmission of poliovirus in the U.S. occurred in 1979. Vaccines are one of the greatest achievements of biomedical science and public health. Motor vehicle safety. The reduction of the rate of death attributable to motor vehicle crashes in the United States represents the successful public health response to a great technological advance of the 20th century, the motorization of America. 6 times as many people drive today as in 1925, and the number of miles traveled in motor vehicles is 10 times higher than in the mid-1920s. Systematic motor vehicle safety efforts began in the 1960s. In 1966, passage of the Highway Safety Act and the National Traffic and Motor Vehicle Safety Act authorized the federal government to set and regulate standards for motor vehicles and highways, a mechanism necessary for effective prevention. Vehicles were built with new safety features, roads were improved, and traffic safety laws were enacted and enforced. Improvements in work safety. At the beginning of the century, workers in the United States faced remarkably high health and safety risks on the job. In 1913, the Bureau of Labor Statistics documented approximately 23,000 industrial deaths among a workforce of 38 million. Through efforts by individual workers, unions, employers, and government agencies, significant progress has been made in improving work conditions. Data from the National Safety Council from 1933 through 1997 indicate that deaths from unintentional work-related injuries declined 90%, while the workforce more than tripled. Tobacco use. Smoking is the leading preventable cause of death and disability in the United States. During the first decades of the 20th century, lung cancer was rare. However, as cigarette smoking became increasingly popular, first among men and later among women, the incidence of lung cancer became epidemic. Other diseases associated with tobacco include heart disease, atherosclerotic peripheral vascular disease, laryngeal cancer, esophageal cancer, COPD, intrauterine growth retardation, low birth weight, lung cancer, asthma, and respiratory infections. In 1964, the U.S. Surgeon General concluded that cigarette smoking is a cause of lung and laryngeal cancer in men, a probable cause of lung cancer in women, and the most important cause of chronic bronchitis in both genders. Reductions in smoking result from many factors, including scientific evidence of the relation among disease, tobacco use and environmental exposure to tobacco, dissemination of this information to the public, surveillance and evaluation of prevention and cessation programs, campaigns by advocates for non-smokers' rights, restrictions on cigarette advertising, counter-advertising, policy change such as increased taxation, improvements in prevention programs, and increased understanding of the economic cost of tobacco. And finally, decline in deaths from heart disease and stroke. Heart disease has been the leading cause of death in the United States since 1921, and stroke the third leading cause since 1938. Together, they account for approximately 40% of all deaths. Age-adjusted death rates per 100,000 persons for diseases of the heart have decreased 56% from a peak in 1950. Since 1950, stroke rates have declined 70%. Factors contributing to this include a decline in cigarette smoking among adults, a decrease in mean blood pressure levels, an increased percentage of persons with hypertension who have the condition treated and controlled, changes in the U.S. diet, and improvements in medical care. So there have been a number of changes nationally in healthcare over the last 100 years, but how has it changed in Peak? The providers here have had more than just healthcare challenges to deal with in order to provide care for the good folks of our community and its surroundings. In the early 1900s, one of my great-grandfather's patients, 1/3 of my great-grandfather's patients, were on the other side of the Broad River. At that time, there was no highway bridge crossing the river, so the only access to Fairfield County was the railroad trestle, which we now consider a symbol of our practice, a bridge to health care. For 33 years, Dr. Pinner Sr. fought disease and the river. In the early days, folks needing services sent a buggy to the opposite side and a man across the trestle to retrieve him. In the early 1920s, he bought a Model T, the first to own a car in the community, and he later bought a second one to park across the river for house calls. His car across the river had to be moved when the water level would rise. And on one occasion, when the floodwaters were rising, he had a man swim in with a rope and tie his Ford to a tree to keep it from being swept away. He once said, "Train schedules across the river are known precisely by every man and child for miles around." This struggle continued when my grandparents joined him in practice, and he acknowledged that, "I fought the Broad for 33 years, but never quite licked it. The battle now goes to my son and daughter-in-law. May they have better luck than I've had." When the Highway 213 bridge was completed in 1961, it was dedicated to him. Although the trip to Fairfield County was eventually made easier with the building of the Highway 213 bridge, the allure of the trestle was something that my grandfather could not resist. My Uncle Mike, the youngest of his 5 children, recalls him driving his Jeep across the trestle once when they were met by the oncoming train. Mike says that he'd never traveled so fast in reverse, and that my grandfather spun the Jeep off the track without flipping it, just in time that the train missed him. And he still had his pipe in his mouth. He was known as a Renaissance man with a keen intellect, a warm bedside manner, and a reckless way with machines. On one occasion, while having problems with the headlights in his car, he ran off into Lake Monticello on the way to a house call one night. He swam back in to get his doctor's bag and walked another mile to get to the house call. My Aunt Judy recalls that in the early days of I-26, there were no exit markers. She drove him on a house call in the middle of the night to the St. Andrews area, and when leaving to come home, she was instructed not to wake him up until they got home. Since there were no exit markers, she kept driving, and at sunrise, they reached Spartanburg. After this incident, he used a connection at the DOT to get a peak exit sign on the westbound lane of I-26. And there is still only a peak exit sign on the westbound lane today. My father and his siblings also often went along on house calls. Sometimes they were left behind. Sometimes his pipe was left behind. He often left his pipe on the steps of the church on Sunday mornings, and years later, Mayor Lewis Shealy found one in the shrubs cleaning up long after my grandfather's death. When the stained glass windows were installed in the church, a small pipe was placed in some shrubs in the large window over the front door in his honor. More importantly, though, as a physician, he was known as a good listener. After his passing, Bill McDonald, a columnist for the state newspaper, said, "He was a good listener, and people remember good listeners, which isn't hard. There are too few of them. You remember someone who listens to what you mean beyond what you say, who never lets questions get in the way of answers. Someone with the calm confidence of an open mind who shows you genuine respect and concern." The article went on to quote Doree Smith, who was the wife of a former Mount Hermon pastor. She said, "He was not an orator. He talked a lot, but he mumbled a good bit too. Mostly he was a doctor who listened to his patients, and he was a friend to everybody. Poor and rich, black and white, he saw no difference in the races." While Carroll Jr. may have been known as a Renaissance man, the word Renaissance could certainly apply to my grandmother as well. She could easily be considered a pioneer for women in the field of medicine. She was the only female in her class at the Medical University of South Carolina in the early 1940s, and once told me that the only other 2 women in medical school while she was there were 2 years behind her. As a result, she was a natural and easy target. She was once locked in the refrigerator for hours with the cadavers that they studied. When she missed a few days of school to have my father, a few days of classes to have my father, the professor asked her why she had missed class. Her response was, "Would you call having a baby a good excuse?" He apparently had not noticed that she was pregnant, and after that, he carried a chair around for her to sit down on hospital rounds. Women often came to see her because they began to prefer a female provider, and she was renowned for her excellent diagnostic skills. She worked just as hard as any other who has served here, and I'm told she even made 3 house calls on the way to the hospital when in labor with my Uncle Mike. She and my grandfather delivered babies until the late 1960s, home deliveries of course, and as a result, my aunts and uncles went to school with lots of boys named Carol. Her retirement in 1989 left a void that we still have not been able to fill. The town of Peak itself has dealt with setback over the last 100 years. Peak was once a thriving community, being the last stop before Columbia on this side of the Broad River along the railroad. It was an area of business and entertainment. My great-grandfather was a big fan of baseball, and on Saturday afternoons, he and others would gather across the way for baseball games or downtown to play checkers and socialize. Peak has suffered from 3 significant fires, the first in 1909 before our practice was established, the second in 1953 shortly after my grandparents returned here to practice, and the third in 1978 not long after my father returned here to practice. When the office was rebuilt after the 1953 fire, there were no segregated waiting areas, which was uncommon for that time. When the office caught fire in 1978, a reported 50 firefighters from 3 different counties came to control the fire, and 15 fire departments responded. There was an outpouring of support from the community to rebuild, and they were back in business in 1 week. Everyone worked to clean, others to feed the workers. My Aunt Mimi, who was in pharmaceuticals, was given instruments by other items by other physicians donated to help the Penner Clinic reestablish. There were unsolicited contributions made, and an x-ray machine was donated. The actions of everyone served as a testament to what this family and this practice meant to the community. So what about the Penner Clinic today? My father has served the practice since 1975. My Aunt Laura once said, "I think he has Broad River water in his veins." Dr. Ferguson has been here since 1984, and I jokingly told him when I joined the practice 8 years ago that he was no longer the new guy. The stories of our legacies can be told in another 100 years at the bicentennial celebration by our descendants. Walt McLeod will be there. It is somewhat amazing that a small private practice, family practice, can continue to thrive, but much like adjusting to the water levels of the Broad River, we have adapted and continue to provide a vital service to those near and far, and we certainly appreciate the support that our patients give us and hope to continue our service for many years to come. Dr. Carroll Sr. once said, "Remember that patients put the clothes on your back, the shoes on your feet, and the food on your table, so always treat them with respect." These words of wisdom still resonate here today. Thank you all for joining us today in celebrating 100 years of service by the Penner Clinic.
Good afternoon, ladies and gentlemen. Can you all hear my voice? Is it too loud? Well, thank you for allowing me to participate in this very, very meaningful ceremony. Dr. Ben Penner, please know that I intend to be late for my own funeral, but I will not be late for yours. Thank you for including me in this very magnificent celebration honoring the 100th anniversary of the Penner Clinic, practicing the healing arts in Peak, South Carolina for the past 100 years. And thank to each person who worked so hard to make this event a resounding success. To the members of the Penner family, to those persons here who are practitioners of the healing arts, citizens all of Newberry County, Richland County, Fairfield County, and a little bit of Lexington County. You know, if you were looking for an institution which has served the Central Midlands Council, Central Midlands area, extremely well, you don't have to look any further than that building right over there at the Penner Clinic, and the persons who work there on a daily basis, who provide high quality health care, primary care to persons who live in the 4 counties I named. Senator Croma and I are pleased to represent Peak, South Carolina in the Penner Clinic at the State House in Columbia. Now I really do regret that I did not have the opportunity to know Dr. Carroll Penner Sr., the guy who walked across the trestle to deliver health care, making house calls to people in places like Parr and Jenkinsville and other places in Fairfield County. I'm just as glad I didn't have the need to walk across that bridge with the train coming. I would also say that it's my pleasure to know Dr. Harriet Ellen Penner, who worked at DHEC for about a decade during the 70s. I worked there as a lawyer for many years. I was a kid lawyer at DHEC, and I well recall Dr. Harriet Ellen Penner was the first person to successfully explain to me, I know it now, folks, but at that time I didn't know the difference between Medicare and Medicaid. After she told me about 4 times, I understood. And I've been hearing about it ever since. I've enjoyed tremendously knowing Dr. Carroll Penner III, Dr. Ferguson, Dr. Ben Penner, a registered nurse named Dinah Penner, and other healthcare professionals who have worked at the Penner Clinic and serve our citizens so extremely well. I've called on the phone there and say, is there somebody there now? Because they're looking for me, and sometimes I've come to see them. So the Penner Clinic has been a very, very, very important part of the culture of our 4 county areas. I, for one, want to thank the Penner Clinic and all those people who work there, not only now, but for many years in the past. People who have worked diligently to deliver health care services and practice the healing arts for the citizens of our 4 county area. If there's an institution, as I said earlier, which is sort of a hallmark for providing health care services to those citizens of those 4 county areas, it would be the Penner Clinic. I am pleased to represent at the State House in Columbia Senator Ronnie Croma. He and I have a handsome resolution here to hang in the Penner Clinic. It's a good-looking ornament. It's a legislative resolution. I don't want to read it all, but it says a resolution to congratulate the Penner Clinic in the town of Peak for a century of outstanding medical service and to wish the staff continued success in the years ahead. Then it names the 4 doctors, and it says, whereas it is appropriate for the legislature to note the milestone achievement of the Penner Clinic and express their admiration for a century of providing dedicated medical care to many generations of grateful patients. And I repeat that, many generations of grateful patients. In this day and time, we've got a medical care system far different from what we had 100 years ago, far different from what we had 10 years ago. I'm really not up this afternoon to explain it to you all because I can't explain it to myself. But it's mighty complicated. So I have here a copy of this resolution for Dr. Carroll Penner and ask him to come forward, provided to our citizens, and thank you from the bottom of our heart. Thank you. And another one for Dr. Ben Penner. thank you for coming home. We want you to keep this place alive for another 100 years. All right, thank you so much. Who's the office manager at Pinner Clinic?
Louise Rex.
Where is she?
Right there.
Well, if she's here, I want to present this handsome frame resolution to you. And I want you to hang it on the wall in the Pinner Clinic on behalf of Senator Cromer and me. Thank you so much for your service. My friends, it's a pleasure being with you. I particularly enjoyed the story about the Peak exit. There are worlds of people nowadays who I see on a routine basis. And I said, where do you live? Well, at the Peak exit. There are hundreds of people who do not live in Peak. You know, everybody's got to be from somewhere. And instead of naming some subdivision, they say, I live at the Peak exit. So the Peak exit is going to be real big, real soon. We just want you to keep the municipality of Peak alive and well so that the Pinner Clinic can continue feeling at home and provide high quality medical primary health care for the next 100 years. Thank you so very, very much.
Do that. I don't really need that. I hope I got the list. Here it is. I would like to introduce our present staff. If you come to the Pinner Clinic, when you check in, the person you're most likely to encounter first is Sandy Kiker. Sandy, where are you? There she is. If Sandy's not there manning that window, it would be Brooke Chambers. Where is she at? She's sitting on the ground there. And then if neither one of them are there, either Sandra Hill or Monica Curcio, and they're standing right beside each other right there. That's who sits in our front office. If you mess up while you're there, you might encounter our office manager, Louise Rex. And there's a couple other people are in the what we call the back office. Prim Heiser. Is Prim here? I haven't seen Prim.
She's in the mountains.
She's in the mountains, okay. And that's where we'll also keep Peggy Bowers and Allison White. They have to take care of our dealings with the nuclear plant. It's so big we can't handle it by ourselves. If you have to get blood drawn while you're there, you will encounter Tracy Gladden. Where is Tracy? There she is. Now, if you come to see Dr. Carol Pinner, you will first encounter Philoma Skipper. Is Philoma here? Okay. If she's not there, you might encounter Marcia Howard, or you might see Paige Stroud, or Donna Mason. So those are the four that keep Dr. Pinner straight. If you come to see Dr. Ben Pinner, you'll first encounter Susan Bullard, who he stole from me. It's her own fault. She talked about retiring so long, she finally convinced herself. His other two nurses are Kenna Vega and Meredith Williams. If you come to see me, the person you will encounter first is Beverly Bush. Beverly here, I hadn't seen her either. Okay. And then my other two are Brittany, Dominic, and Rhiannon Larson. Rhiannon's actually been my home health nurse for the last 3 weeks. And when you check out at the Pinner Clinic, these are the two people you always fuss at, but I'll remind you now you shouldn't fuss at them. It's not their fault at all. Ann Long and Audrey Cease. And last but not least, if you come on a Saturday,
you might encounter Haley Waltz. And I saw her here somewhere a while ago. Where'd she go? There she is. Now, did I leave anybody out? All right. I'd also like to ask if there's anybody here who has worked for us in the past. Raise your hand or stand up. All the children, of course. Pam, we're going to have a little help getting off of here. Thank you.
It's indeed an honor and a pleasure to have all of you here today. I want to be sure that you all sign the register up there so that 100 years from now I can look at that and see who they invite back. A little thing to talk about first. If anybody has anything that they would like to say positive or negative after I speak about Penner Clinic, some remembrances, we'd love for you to come up and we'll hand you the mic or you can just stop and speak. So we'd love to hear what you have to say about what's going on in the years past. Now a little better? Yeah. Okay. To paraphrase President Clinton, let me be perfectly clear. The rumor that I started the Penner Clinic in 1915 has been greatly exaggerated. I've always liked to tell people that we're not as big as the Mayo Clinic, but we're just as old. I'd like to give you some remembrances that has happened over the 100 years, some stories that have been passed down about all my parents and grandparents. First was Dr. Carroll Penner, and as been alluded to, he was the first physician to own a car in this section of the woods. And he had the unlikely thing to have two cars, one on the other side of the river. And he was right. When the hurricanes came through in 1929, he had to tie his car to a tree. He also, back in the 1920s, had bought a red wall tire. Now, back in the 20s, they made white wall tires and they made black wall tires, and they made a red wall tire. But the red wall tire was kind of rare. My granddaddy went over there one day and somebody had stolen his tire. So a couple weeks later, he put another tire on, and he was riding down the road in Fairfield County, and he met a fellow with a red wall tire, and he stopped him and he took his tire back. There's a story also that when he was on emergency house call for Fairfield County, and a train was on the trestle, and he couldn't get across the trestle. So therefore, he decided he was going to walk across the top of the boxcars. And as he was doing so, the train started pulling out. And he had to climb on down on the side of the boxcar, and it was dark, it was night, and he had to jump off the side of the railroad. He was battered and bruised, but he still made the house call that night. On the other hand, I would like to talk about one other thing about Dr. Penner Sr. And I'm going to talk about Mr. Harold and Carol Wicker. Now, this may provide some HIPAA violations, but I'm going to do it anyway. Harold, where are you? Raise your hand. Right here. There he is. Back in 1939, my grandfather, Dr. Carroll E. Penner Jr., delivered Harold and Carol. Their birth weight was 3.5 pounds. 3 3/4. 3 3/4. Okay, I got that. One weighed about 1.5 pounds, and the other one weighed about 2 pounds. Weighed about 2 pounds. Anyway, Dr. Penner told them that probably wasn't going to live through the night, but when he fooled them, he decided what they were going to have to do. The first thing they were going to have to do was build a box, and they were going to have to surround that box with hot water to keep them warm, because this was in January. And of course, the only way to heat the water was the fireplace. Second thing he was going to do is he was going to have to get them a cow. And they were going to have to feed that cow a certain diet, and you were going to have to milk that cow every 2 hours, around the clock. Number 3, you had to put some ground up chicken livers in the milk in the bottle, along with 5 drops of corn liquor. I suspect they must have had the colic is why he did that, but I'm not sure. Anyway, I haven't been able to read anywhere in the medical journals why that was successful, but apparently they're still here today. An interesting story is that they were identical twins, and the only way they could tell which was which was because of a bracelet that they had on. Well, one night the bracelets came off. To this day, I always thought Carol was Harold and Harold was Carol. Anyway, the delivery fee back in those days was $7. And Mr. Worker said, "Doc, I don't have $7. I don't make $7 a month, much less going to be able to pay him." And Dr. Pinner said at the time, "Who said I was going to charge you $7? Anyway, Mr. Worker, being the honest fellow he was, managed to pay about 25 cents every 3 to 6 months. Now let me calculate that. Let's see, 25 cents and $7. Harold, you may still owe me some money. Change the subject to my father, Dr. Carroll A. Pinner Jr. He was known as a demolition expert. It was the time that there are several stories, it was the time that he got the car stuck in Lakes Creek, and the thunderstorm came along, so he had to open up all the doors so that water would flow through and it wouldn't flow down the river, down the creek. There was the time that he caught a possum and put it in my mother's glove compartment in a brand new Rambler Ambassador. Needless to say, when my mother went out to check the car the next morning, heard the scratching and opened the glove compartment, there was a possum. I also caught a possum one time and put it in the trunk of the car, and that possum ate a hole back up under the back seat, and you couldn't get it out. But finally we got that possum out. Back in he had 3 major wrecks during his lifetime. The first one was in 1953, in which he ran into a fellow up at Bonner Skating Ring. He pulled out in front of him, and he had a pretty good wreck at that time. He had some facial fractures, and Dr. Bobby Livingston's here today, and his daddy took care of him at Newberry Hospital at the time. Survived that. The second major wreck was in Pomeroy, in which he was coming up the hill from the town of Pomeroy up towards Tallahassee store in a 1968 Chevrolet. Ran off the road, flipped it 3 times, landed upside down, crawled out without a scratch. Now the last time, Ben briefly alluded to just a moment ago, but I'd like to tell you the whole story. He was on a house call one night, going up Broad River Road here, and as you go up Broad River Road, and you come to the first field, I'm not sure which one it is, never have, but it was a 1-lane bridge, and as you cross that 1-lane bridge, the road would bear immediately at a 45-degree angle to your left. Well, the Golden Guinea had a short in the electrical system, and if you kicked just right up under the dash, the lights would come back on. Well, he was going across the bridge, and he kicked, and the lights went out, and he kicked up under the dash, and lo and behold, they didn't come on. So into the water he went, and of course the car sank, and he crawled out the window and was able to get out, swim to the bank. And he made that house call later on that night. The next day they went, fished that car out, pulled it out, had 3 catfish in it. Smelled like Broad River for the rest of the time he drove it, which was another 6 or so years. Now, there's an interesting story Mr. Gerald Sheely told me the other day. He said that when he was 16 years old, lived over in Chapin, he had the mumps. And they called my daddy to come see him because he had the mumps. And Gerald says he remembers sleeping in bed that night, and he woke up around 3 o'clock in the morning And at that time, they had a string that went to a light in the middle of the room, and you could reach up and pull on that string, and the light would come on. Well, Gerald pulled on the string. Dr. Penner was in bed next to him sleeping. He said, "Turn out the lights on, I need some sleep." Gerald couldn't go back to sleep because he thought if the doctor was there spending the night with him, he must be bad sick. Now this is a little risque, but one time my daddy had a lady who was having trouble getting pregnant. She was having all kind of trouble getting pregnant, so she came in to see him, and he said, "I understand your problem. Why don't you just go ahead and slip your clothes off and hop up on the table, and I'll see what I can do." And the lady said, "Doc, I really don't want to get pregnant right now." Now my mother, she was a pioneer, as Ben alluded. I'm the cause that she missed that one day in medical school. I'll never do that again. She was a pioneer. I've had so many ladies that after she retired would come in to see me, and they would tell me, "You know, you're good, but you're not as good as your mother." And I would always answer, "You know, I'm keep trying. If I keep trying, I'll get as good as she is." Never got there. Never will be. Finally, myself. There are a couple truisms that I have, one-liners that I think that pertain to my practice that I think are interesting. One is, you can only hold your stomach in for so many years. Number two, you can only remember so much. Number three, memory loss isn't so bad. You can make new friends every day, and you can hide your own Easter eggs. Youth passes with age, but with luck, immaturity can last a lifetime. Got a lot of those. You should always go to your patients' funerals. Now the reason for that is that if you don't, they probably won't come to yours. And finally, medicine is 50% psychology. The physical part is, excuse me, I said that wrong. Medicine is 80% psychological and 50% physical. You do the math. If there's anybody who would like to come up and say anything, we would love to have them just to do that, to help with the memories.
Community and beyond with the Penner Clinic, all of those who have worked there, all of those who have been treated there. We ask that as we go from this place that you would continue to turn our hearts towards servanthood as you call us to do, that you would be with this practice during its next 100 years and however long it exists, but most especially that you would fill us with the love that can only come from you, that leads us to open our hearts to others around us, that we may be a blessing as we have been blessed. So may the blessing of Almighty God, Father, Son, and Holy Spirit be with you now and always. Amen.